We start with breaking news. An independent CDC panel has voted to recommend restarting use of the Johnson & Johnson COVID vaccine. The vaccine has been halted since last Tuesday following an extremely rare but serious blood clotting condition. Vanessa Rufus has been following this meeting all day and joins us now with the very latest. Hey, Vanessa.
Hey, Sarah. Yeah, this vote just happened a few minutes ago. We've been monitoring this meeting all day long, and really the discussion we saw play out over the recent hours was risk versus benefits. Who and how many people would lose out if they restarted J&J, and who and how many people would lose out if they kept the pause in place. And so essentially what we saw here, most of the panel going forward and wanting to recommend restarting Johnson & Johnson for all approved populations, which would be those 18 and older. So a reminder that the issue at hand were these potentially linked, very rare but serious blood clots with low platelet counts. This incident rates that they were following here, roughly 1 in a million for these particular conditions. And we also know that the reports are overwhelmingly more so for women on the younger side. So we mentioned risks versus benefits. One of the things we saw this panel was introducing was this, how many more cases of this clotting condition they would expect if they did the restart, and they essentially found over 6 months 20 to 40 more cases of this rare clotting condition could happen, but they would also be able to head off as many as 3,500 ICU admissions and 1,400 deaths. So they saw it was overwhelming the benefits of having J&J in circulation. Now we know vaccine providers are planning to encounter some vaccine hesitancy, folks who are going to be a little bit put off from this initial pause, but they say that they're going to be willing to work through that with folks who have questions. Take a listen.
Telling someone that they have to do something that they don't want to do is never likely to help them make a decision that changes their mind. But all we can do is offer good information to help to calm any concerns that they might have.
And so just a reminder here that this is an independent CDC panel making this recommendation. So ultimately, it does come down to the CDC itself as well as the FDA to formally restart this, but we don't have any indication that the agencies would go against what this panel recommended. Back to you.